Ensuring a healthy population is one of the pathways that Uganda has undertaken in addressing hindrances to its socio-economic development as per its Vision 2040. Tremendous progress has been registered in the health sector, although maternal and child health continues to challenge the entire country. For instance, the Busoga sub-region in eastern Uganda is one of the regions grappling with high maternal and child mortality and morbidity rates.
The number of mothers who die as a result of pregnancy-related complications is high. The number of newborns dying also is high. In addition to the high maternal mortality, Busoga also has a very high adolescent pregnancy rate.
The health situation in Busoga sub-region has been worsened by poverty, leading to glaring disparities in access to health services, hence the poor health outcomes among children and pregnant women. With a population of 3,918,500 people, the sub-region has been ranked third poorest in the country. It is against this background that the Korea International Cooperation Agency, in partnership with the World Health Organization, are working with the government of Uganda to implement health system strengthening project to end preventable maternal, newborn, child and adolescent health challenges in a bid to improve health indicators in Busoga.
The health service availability and readiness indicators were poor, and majorly this was characterized by inadequate infrastructure, inadequate skills to deliver the service, and weak referral system and high pregnancies among teenagers.
Under this intervention, 7 state-of-the-art ambulances have been procured and distributed in districts of Busoga sub-region. These include Buyende, Kamuli, Bujiri, Iganga and Mayuge. The ambulances have been instrumental in supporting the referral system in the region.
When the WHO gave us an ambulance, now we see there is a bit of system strengthening through referral system. This ambulance has done a lot as far as saving mother life concerned.
If this somebody is coming from the health facility, they communicate to the referral point so that by the time the patient arrives here or the mother, we have already prepared to receive this mother.
The health system strengthening project further addresses the challenge of mothers who die from bleeding complications. These deaths are occasioned by inadequate health worker skills and shortages in commodities to manage bleeding. Health workers have now been trained in emergency obstetric and neonatal care and other soft skills for better health service delivery in the 5 districts.
The way we are managing antenatal mothers was really not impressive. So when we received these trainings, we managed to change our behaviors, change our attitudes.
We innovated an approach where we would hold our quarterly meetings in the field, not in the boardroom. It also provides us an opportunity to see firsthand what actually is being done, how services are being delivered. Are they quality services? Are they respectful? What are the infrastructure challenges? So a very good innovation from our side, and I think it made the project move smoothly.
Although this project targets women and children, adolescent girls and boys in school have not been left behind. Working through the education system and youth-friendly spaces in health facilities, adolescents are now able to meet their sexual reproductive health needs.
Before the training, these people were not smart, they were not clean. But after now that training, teachers came back and they were hinting on being clean. And these girls had to know how to make those pads. We see that girls are now protective of their bodies.
Boosting the skills of the health workers has helped us to handle the adolescents, to help them attend to their needs and challenges. There are those who come for family planning. There are those who come when they are sick, like with the sexually transmitted infections, which they don't want to tell others, but they can tell these trained health workers.
The health system strengthening project to improve maternal, Child and Adolescent Health Services in Busoga sub-region aims at building systems that will improve the quality of care for better health outcomes in Busoga sub-region.
I would like to express our appreciation to the government of Uganda through the Ministry of Health, Ministry of Education, Ministry of Local Government, Ministry of Finance, and the district leaderships for their commitment to the people of Uganda and their engagement with us and collaboration, which is bearing fruits.
We are building capacity in our health centers to be on our own. But as we build capacity, we need assistance from other people. We are grateful to the government of Korea, to WHO for identifying these areas where there is a need and also boosting our capacities to handle these needs. But also I appeal to our own communities also to be a little bit more careful. Our medical workers, our medical personnel should also be able to handle this equipment with care, such that they last the years they were supposed to last.